Is it in any way Donnelly's fault? Could he have done something different? Because he's not a doctor. His background is in business consultancy, but there are people who plan the winter plan. They know the ins and outs of hospitals. They know how it's done. And the winter plan, it seemed to be, a good plan this year, but the triple-demic came along and it was overwhelmed. I mean, where does the blame lie if blame is to be apportioned?
Well, there's two things. Stephen Donnelly's in office since June 2020, so he's not responsible for the decades' neglect or the kind of the systemic failures of successive governments to invest properly in our hospitals and to provide enough beds. As you said, we came from a position where the active policy was to reduce the number of beds. We obviously, they've had to reverse fare, but we've also had a decade, Pat, of this identity crisis in relation to the HSE. Fine Gael took office saying they wanted to abolish the HSE. That clearly became untenable, so they've had to reverse fare it on that. So you've had this idea of the HSE not really knowing what it is to do. Second of all, you've got a situation where the Minister for Health does not actually have the levers of power to affect change at his disposal. They're in the hands of the HSE.
Yeah, but the politicians did that to themselves for a very good reason. They didn't want the blame. Yeah. So they set up, the health boards used to be the buffer. Then they set up the HSE and it backed and forward and so on. But the idea was, not my fault, it's Paul Reid's fault or somebody's fault, Brendan Drumm's fault, it's not my fault. So when they have no power to intervene, it's their own fault.
It is, but the fundamental problem with that position is that they're still electorally accountable, and in the public's mind, the Minister for Health is ultimately responsible. So you're left in a position, you take all the flack from the opposition. You'll no doubt probably see a motion of no confidence in Stephen Donnelly in the next 10 days or so, whilst the Dáil reconvenes on the 18th. And what you'll see is Stephen Donnelly getting all the blame, but he has, as I said, he has none of the power at his disposal to directly improve things. And what you see is a real discrepancy between hospitals that are very good at moving their patients through, almost getting, because they either operate within budget or actually manage to kind of save a few quid here, rather than being allowed to divert that money to improve their lot in their own hospital, they're surrendering money back. It's kind of perverse in a way. The better you do, the more you get penalised. The worse you do, the more you end up getting rewarded. And I think there needs to be a fundamental shift in that. One of the missed opportunities I feel, and this is something that is likely to come up again in discourse in the coming weeks, is that there was an opportunity for the state to buy 2 or 3 of the private hospitals during COVID-19, because they were essentially begging to be bought out at that stage at a pretty reasonable price. That would have done an awful lot in terms of the capacity issue, particularly for more elective surgeries and procedures. They didn't do it. The risk-averse nature of the state said, no, it's too risky, it'll take too long and be too cumbersome. Missed opportunity there. We're about 5,000 beds short in the system from where we need to be. That's not going to get sorted today, tomorrow, or
and the problem
soon.
is, if we look at the paediatric hospital in St. James and how long it's taken to build, how the overruns. I mean, if Jimmy Sheehan was willing to sell Hermitage or Blackrock Clinic or whatever, these were hospitals that were built efficiently and didn't cost the earth like the paediatric hospital. No. I mean, can you trust the state ever to build a hospital again, or should you just bring in a hospital building company fit for purpose who'll build one and flog it to the state at the cost plus 15% profit?
Well, there's a catalogue of examples of how the state has proven itself unable to do major projects. And going back, you look at the Port Tunnel, how much the overruns there, and Dublin Airport Terminal 2, described by Michael O'Leary as a white elephant. Badly built, badly designed, all the rest of it. And now we're here in a situation where, as you say, the National Children's Hospital has become this great saga of cost overruns, and the government and the state are so invested now they can't back out of it. They're kind of held over a barrel now because they have to see the project through no matter what the cost. And obviously we know that there's this massive arbitration process going on with BAM, the main contractors, and there's disputes over kind of costings, etc. like that. But at the end of the day, it's taxpayers' money that's going down the Swanee essentially, or there's a much greater cost. But to the accountability side of this, Stephen Donnelly, begged, borrowed, and stole essentially to be kept on in his job. He pled the argument of continuity that to take him out and put somebody else in, you're going to lose 12 to 18 months of momentum. He needs to prove. He needs to now show a bit of delivery. He needs to show a bit of performance, and he needs to show a few results now that the trust, I suppose, invested in him by Micheál Martin was worth it.